now let's cover the concept of receptors. A number of different types of receptors in our body, and we can signal them in a number of different ways. Well, first is our natural ligands. This is just our natural endogenous signal to that receptor. It's in our body, it fits perfectly. We have agonists, which are medications. When we talk about medication agonist, a drug agonist, this will fit into that receptor and stimulate it, but it's not like a perfect fit, but it still stimulates it. Then we have these antagonists. We have these medication antagonists, which block this receptor from anything that would try to stimulate it. So if you think of it, the receptor as this doorknob, our natural ligand is the key that fits into that doorknob. And it's natural. It fits perfectly and unlocks that key, or unlocks the door, I should say, and that's our perfect natural fit. Our agonist there in the middle, well, it's still going to unlock that door, still going to fit into that keyhole. It's still going to stimulate, still going to activate that doorknob and that lock, but it's not the perfect natural fit. But that's our medication, that's our agonist medication, and it still fits in there, still activates it, and still kind of does what we want it to do. Then our antagonist, there, if we take a stick and shove that little stick into that keyhole, well, now nothing can get in there. We're just saying, like, well, screw you, right? So the antagonist, the drug that we give that is an antagonist, is going to block that receptor site from anything getting in and stimulating it. The agonist side, so I've given a medication that is an agonist, well, we're going to make it a little bit more complicated because why not, right? So we've got full agonists. We have partial agonists. Well, our full agonists, we have direct and indirect, so we're going to split it out again to confuse you even more. So we have agonists, we have full agonists, we have direct full agonists, which directly bind to and activate that receptor site. Then we have indirect full agonists, which increase levels of the substance that activates that receptor without actually binding the medication itself, actually binding to that receptor. So, as an example, we've got medications that activate dopamine receptors. Let's go with dopamine. Dopamine receptors. I've got direct full agonists. The medication itself is going to bind to that dopamine receptor. But our indirect full agonists, instead of binding to that dopamine receptor, they are going to increase the level of dopamine in your body so that there's more dopamine, endogenous dopamine, in your body to bind to those receptors. So we're still, the end result is the same. We're just going about it in different ways. Then we've got our partial agonists, which partially bind to these receptors, and they kind of produce this submaximal response. So, maybe we have some partial dopamine agonists, and they kind of tickle, kind of stimulate the dopamine receptors, and the dopamine receptors are like, yeah, fine, I'll do a little something, but it's not as much as our full agonists. So partial agonists kind of do a little bit, full agonists do all of it, and then we've got direct and indirect, which do all of it, but just in kind of different ways. So our direct agonists bind, the medication itself binds directly to the receptor. The indirect agonist just increases the thing that binds, that it stimulates the receptor itself. So dopamine receptors, our indirect agonist, will increase dopamine levels so that we have more dopamine to stimulate dopamine receptors. Let's talk antagonists. We have a couple flavors of antagonists. So if I give an antagonist medication, we are blocking this receptor, but we can do it in a couple different ways. We've got competitive antagonists and non-competitive antagonists. So our competitive antagonists, they're binding to this receptor and blocking action, but they are binding to the same site as an agonist would. So they are competing with an agonist for that same site on that receptor. The non competitive antagonists bind to this receptor, but in a different place than the agonist would. So, if you were to give an agonist and an antagonist for the same receptor site at the same exact time, if it's competitive, they're going for the same site on that receptor to bind to. If they're non-competitive antagonists, then that agonist and that antagonist will bind to that receptor in different places. And when giving these medications, whether they're agonists or antagonists, whether we're stimulating and tickling these receptors or we're blocking these receptors, there are a number of factors which that factor into. No one. Okay. Lots of factors going into the drug response. Age, as you get older, you respond a little differently to medications. Body mass, if you're larger or smaller, is going to affect drug response. Even gender, a little bit. So gender goes into proportionality, tissue proportionality, and metabolism, metabolitic proportionality, genetic factors. Some people are just predisposed to respond to medication stronger or not so strongly, right? Pathologic states, hypothermic patients. Hyperthermic patients are going to respond differently to medications that we give them. Psychological factors, you know what? There's a lot to be said about psychological factors in giving medications. If I am convinced that the morphine you are giving me is not going to help my pain, it is probably not going to help my pain because I'm just going to be so focused on that pain. On the other hand, if you were to give me a placebo and tell me this is going to cure all of your pain right now, and I was totally on board with you, it's probably going to help my pain a little bit. So, all of these factors are going to affect the response of any medication that we give our patient.